Varicose veins are usually caused by weak vein walls and valves. Inside your veins, there's tiny one-way valves that open and let blood through, and then they close to prevent it flowing backwards. Sometimes the walls of the veins become stretched and they lose their elasticity, causing the valves to weaken. The main cause of varicose veins can be being female, being older, pregnancy, long periods of standing, obesity, genetics, smoking, and being inactive. Varicose veins are abnormally enlarged veins, and they occur anywhere in the body, but they're usually found in the legs. When left untreated, varicose veins can sometimes cause high blood pressure, or even cause a sudden drop in blood pressure, known as orthostatic hypotension. This drop in blood pressure, when going from lying down to standing up, can be partially due to the pooling of the blood in the varicose leg veins. There's many natural ways that you can help to treat your varicose veins. Horse chestnut appears to impair the action of platelets, which are important components of blood clotting, and they also inhibit a range of chemicals in the blood, including cyclooxygenase, lipooxygenase, and a range of prostaglandins and leukotrienes. These effects result in reduced inflammation and reduced blood pressure. Horse chestnut seed extract has consistently shown benefits for the short-term treatment of varicose veins. Since the treatment for this condition will need you to continue it for many years, long-term studies of horse chestnut are needed. The herb yarrow was commonly used during the war to stop bleeding from an injury. Essential oils extracted from yarrow have been used traditionally for treating varicose veins. When a person applies yarrow to the skin or above varicose veins, it can help to reduce their symptoms. When taken internally as a tablet or a tincture, it can also help improve the elasticity of the veins, reducing varicose vein symptoms. Regularly getting exercise is one of the best things that you can do to improve blood flow and to lower inflammation. So you can add this to the extensive list of all the other benefits that exercise has. The National Heart, Blood and Lung Institute states that sitting, especially with poor posture, like forward head posture, or having your legs crossed, or standing for long periods of time without moving, is associated with an increased risk of varicose veins and other forms of blood pooling. When you stay stagnant for too long, it's harder for your veins to pump blood effectively back to your heart and to fight the effects of gravity. Exercise is also a great way to help balance hormones naturally, to lose weight or to maintain a healthy body weight, and to lower blood pressure, which can all contribute to improving varicose veins. The Carolina Vascular Institute recommends preventing varicose veins by performing leg lifts, calf raises, bicycle legs, and side lunges to strengthen and stretch the veins around the legs. Lower impact exercises such as walking, swimming, and cycling are also ideal for varicose vein sufferers, since they help to alleviate the pressure. People who are overweight are more likely to develop varicose veins, especially overweight women and elderly people. Carrying excess body weight puts higher amounts of pressure on your veins, and it can contribute to inflammation or reflux, especially in the largest superficial vein, such as the saphenous vein in the legs. According to a report that was recently published, there's a connection between obesity and varicose veins. For overweight people, varicose veins are often more difficult to assess and treat because they commonly go unnoticed until they progress to be more inflamed and larger in size, up to 4 to 5 centimeters long, deep inside the leg. Certain foods help to reverse inflammation and improve blood flow. This makes it possible to heal varicose veins faster and to prevent future ones from forming. A poor diet, high in things like trans fats, sugar, caffeine, alcohol, and processed food, can contribute to arterial damage, low circulation, blood pressure problems, hormonal imbalances, and weight gain. Many of these foods are also high in salt, as sodium, which is dehydrating and contains toxins that can worsen swelling in the varicose veins. So an anti-inflammatory diet would be advised. Some foods recommended in an anti-inflammatory diet would be high fiber foods. Fiber helps to improve heart health, and it's also necessary for healthy digestive function. Eating 30 to 40 grams of fiber every day is a great way to prevent constipation, which can cause bloating and increase pressure on the veins around the abdomen and the legs. High fiber foods to eat could be chia seeds and flax seeds, which are also an omega-3 rich food, which is anti-inflammatory. Vegetables, fresh fruit, and soaked and sprouted legumes and ancient grains would also be recommended. Antioxidants, such as flavonoids that are present in berries, vitamin C and vitamin E, which are present in green vegetables and citrus fruit, help to strengthen veins, fight inflammation, and improve arterial health. Vitamin E is known to help prevent blood clots. It acts like a natural blood thinner, and it's tied to heart health. Vitamin C is also a powerful anti-inflammatory, and it's beneficial for the health of the skin. Doctors sometimes recommend diuretic pills to help increase urination and to reduce water retention or swelling. You can get the same effects safely by consuming things like fresh herbs like parsley, cilantro, basil, fennel, dandelion greens, cucumber, asparagus, and celery. You don't want to take large doses of diuretics without medical supervision, as it can cause problems such as dehydration, potassium deficiency, or an electrolyte imbalance. Blood pooling, blood pressure problems, and leg cramps, like restless leg syndrome, are warning signs of deficiencies in electrolytes like potassium and magnesium. To overcome these symptoms, you want to increase the intake of things like leafy greens, avocados, bananas, cruciferous vegetables, and sweet potatoes. If supplementing with magnesium, you want to use the form magnesium bisglycinate for best results. You want to start by increasing the dose gradually until the side effects, such as diarrhea or stomach upset, is noticed. Then slowly reduce your dose until you determine your maximum daily tolerable amount that doesn't cause any digestive disturbance. As magnesium is required by over 300 enzymatic processes in the body, it can have profound health benefits after a few months of supplementation. Spicy foods, such as cayenne pepper or curry, help heat up the body and get the blood flowing, adding to healthy circulation and even appetite and weight control. Foods high in omega-3 fatty acids have been known to help blood vessels open, to lower blood pressure, to prevent blood clotting, and most importantly, to benefit people with varicose veins. Fish and seafood like wild salmon, mackerel, anchovies, sardines, and tuna provide omega-3 fatty acids. Many people prefer to supplement, and they take 3 to 9 grams per day of a molecularly distilled omega-3 EPA DHA fish oil blend. Apple cider vinegar improves circulation in the vein walls, and it's an effective anti-inflammatory. Many people find that using apple cider vinegar along with witch hazel on varicose veins helps to lower swelling, and it improves the appearance within just a few weeks. Hawthorn is one of the many plants containing flavonoid compounds, and these improve circulation. Flavonoids are found in many plants like cranberry, hawthorn, blueberry, and elderberry. Several studies suggest that they may reduce leakage in the veins and swelling in the legs. Flavonoids such as quercetin from elderberry have been shown to improve the action of vitamin C, the action of shikimic acid, and the absorption of zinc. Therefore, it appears to be an important cofactor in improving health. Vitamin C is known for preventing cell damage thanks to its antioxidant properties. These properties promote collagen production as well as strengthening blood vessels. Both of these things help to prevent varicose veins from worsening. The best form of vitamin C would be liposomal vitamin C. You can learn how to make liposomal vitamin C cheaply at home in an ultrasonic cleaner. The next best form would be a non-acidic, pH-buffered vitamin C. The worst kind being cheap, acidic ascorbic acid. A study has shown for the first time that lowered serum zinc levels is one of the factors inducing an itch caused by varicose veins, and it's suggested that zinc supplementation may be an effective treatment to help alleviate itching and to improve the quality of life in patients suffering from this. Typical doses of zinc can be from 30 to 50 milligrams per day. However, you should be sure to have an absorbable form of zinc, as many forms are poorly absorbed. Turmeric is a blood cleanser. It inhibits blood platelet aggregation, and it leads to thinner blood. This is especially useful in treating varicose veins. It can be eaten or juiced. However, for best effect, you would consume the extract of curcumin. Typical doses of curcumin are 2 to 5 grams per day. Due to its low bioavailability, it's advised to take it with either biopterin, which is a black pepper extract, or taking it with an oil, such as butter, ghee, coconut oil, or fish oil, to increase its absorption. CoQ10 has many benefits, but for varicose veins, it helps to improve circulation and tissue oxygenation. The best form is ubiquinol, and it's usually taken in doses of 200 to 400 milligrams per day. Varicose veins have been linked to an increased risk of blood clots, and vitamin E prevents platelets from sticking to blood vessel walls. If your leg cramps from constricted veins, a dose of vitamin E can help to reduce the discomfort. Mixed tocopherols are the best form of vitamin E. Data published in the International Journal of Angiology indicated that the pine bark extract may significantly improve the appearance, the swelling, and the discomfort of pregnancy-induced varicose veins and spider vein clusters. Grapeseed extract is a natural remedy, often recommended for chronic venous insufficiency. Some proponents of grapeseed extract suggest that the antioxidant can help to fight chronic venous insufficiency by strengthening the blood vessels and by improving the circulation. Garlic is well known for its beneficial impact on circulation and on heart health. Studies suggest that garlic, specifically its sulfur compounds, which include allicin, can increase tissue blood flow and can lower blood pressure by relaxing your blood vessels. People with varicose veins tend to have an impaired ability to dissolve fibrin. This is where ginger saves the day. It's been found that ginger can improve circulation by dissolving fibrin that pools in blood vessels. Vitamin D helps to keep your arteries and your blood vessels loose enough and relaxed enough to support proper blood flow. Thus, when vitamin D levels are low, your veins will struggle to do their job properly, and vein issues will arise. You want to get a 25-hydroxy vitamin D blood test, and then supplement accordingly to correct any deficiencies with the vitamin D3. Vitamin K has been increasing in popularity in preventing varicose veins. It's recommended to use it topically like a cream. Vitamin K is an anticoagulant, meaning it helps to prevent blood clots and to keep blood flowing smoothly through the veins. For internal use, the best form is vitamin K2, taken as MK7, and typical doses range from 100 to 300 micrograms per day. When Weston Price was studying patterns of diet and its relation to illness, he discovered that K2 helped to prevent numerous diseases, and he labeled it Activator X for its many profound benefits to health.